Hi, this is Jeff Gross from Vikki Fine Pharmacy. We are honored to support Sheba Medical Center, who is on the front lines fighting the COVID virus and serves as a leader of medical care in Israel and across the globe. Vikki Fine has serviced the community since 1962. We have been on the front lines servicing the community during this pandemic across our 3 pharmacy locations. We have added extra delivery drivers, widened curbside pickup. We carry a full selection of PPE products. Our pharmacy provides pill packaging, medication synchronization, and we do deliver and are open 7 days a week. If you have not joined our family, it's time to socially distance from the chain stores and experience Vikki Fine's concierge service.
Hello, my name is Molly Soberoff, and I am the Executive Director of Friends of Sheba Medical Center. For 50 years, the Friends of Sheba in Los Angeles have been supporting Sheba Medical Center in Israel, now recognized for the 2nd year in a row as one of the top 10 hospitals in the world. On behalf of the Board of Directors and our professional staff, welcome to today's webinar. While it has a formal title, to me, its real title is No Luncheon, No Problem. Since 1989, Friends of Sheba in Los Angeles has held a beautiful women's luncheon every single year to celebrate the many achievements and the latest advancements of our beloved Sheba. But this year was different, and our thoughts and our prayers go out to those who have been affected by this awful virus. I am here to tell you, though, that with dedication, strong leadership, and a supportive community like all of you, together we can achieve, even without a luncheon. Supporting the luncheon took on a whole new meaning this year, and one that has never been more critical: to help Sheba save precious lives and support the researchers who are working around the clock to find a vaccine for COVID. Thank you all for your support of Sheba's COVID-19 Emergency Fund. Sheba shines brighter because of your interest, your friendship, and your passion. When you have your lunch today, wherever it is, whenever it is, we want you to know how much we appreciate you. Before introducing today's keynote speaker, Dr. Eyal Cohen from Sheba Medical Center, we have a few quick housekeeping notes to cover. Everyone will stay on mute for the duration of today's session. Dr. Cohen will do his best to address all of the questions you have submitted upon registering, and thank you for doing so. And last, if you have any questions that come up during today's session, we encourage you to submit those in the chat box, and we'll try to have them addressed. Now, it is my pleasure to introduce Eyal Tullar and Vikki Younger, the Dynamo chairs of this year's Women of Achievement Luncheon.
Good morning. My name is Vikki Younger, and I'm proud to serve on the board of Friends of Sheba Medical Center in Los Angeles. It's hard to believe that this year marks my 14th year of involvement with Sheba. It is an honor for me and Eyal Tullar, my luncheon co-chair and fellow board member, to welcome you to today's Women of Achievement webinar. Thank you for taking time to be with us today. Due to the pandemic, Friends of Sheba was unable to host our April 2nd Women of Achievement luncheon in Beverly Hills. We had great plans in store. Moving to a larger venue, given our record-breaking attendance in 2018 and 2019, honoring the amazing Beverly Cohen and Ifat Oren, and raising funds to support inpatient pediatric mental health services at Sheba Medical Center. Our dedicated luncheon committee here in Los Angeles rechanneled our efforts from planning a luncheon to raising over $230,000 for the COVID-19 emergency fund at Sheba Medical Center. Together, we have saved lives and funded critical COVID research. Since the outbreak in February, the doctors, researchers, and nurses at Sheba continue to work 24 hours a day, 7 days a week, to find treatment solutions for COVID and provide the best possible care for all of the men, women, and children suffering from this deadly disease.
Everyone, I'm Ina Tullar, co-chair with Vikki of this year luncheon. We are so excited to be innovating alongside of Sheba Medical Center. This is our very first webinar in lieu of a luncheon. We are thrilled with the amount of money we have raised, and thank you all so much for your support. We would also like to thank today's presenting sponsor, Mikki Fine Pharmacy, and the owners, Gina and Jeff, for believing in Sheba's mission and caring for our local community. It is my honor now to introduce Dr. Eyal Cohen, the Chief Medical Officer and Chief Innovating Officer at Sheba Medical Center.
Hi, thank you very much. It's a pleasure to be here this morning with you. Hopefully we would have preferred to do it in person as we've done in last few years. But with the situation, of course, we're trying to do the best. And the idea here is to tell you the story of what is going on at Sheba Medical Center in the past few months, specifically in regards to innovation. In my role, I'm the Chief Medical Officer and the Chief Innovation Officer at Sheba, and an internal medicine physician in my training. And also the founder of ARC, our innovation program at Sheba. You might have heard about ARC before. We started ARC officially less than a year ago after working on building ARC for a few years with the idea that we want to play a major role in changing healthcare and how healthcare will need to look like by the year 2030. It's a small mission that we've set for us, and that is why we've built a community, an international community or an ecosystem that together we're working on changing medicine and coming up with solutions to the most challenging problems that we have. ARC, which is another story, of course, to tell you the whole idea behind the ARC and the accomplishments that were made pre-COVID. But about 4 months ago, ARC was faced with another problem, and that is COVID-19. This was around the last week of February, beginning of March, when the first patients came into Israel from the Diamond Princess cruise ship in Japan, and Sheba was chosen as the hospital to house those first patients coming in. We needed to make a decision at that point. How much is ARC and our innovation program at Sheba is going to play a major role in this new crisis? Is innovation an essential force that we have to bring to work during this pandemic? Is it just as important as nurses and physicians on the front lines? And it took us a very short while to understand that if we're going to beat this virus, which at the time we knew very little about, and we still are much in a mystery about a lot of the things around this virus even today, innovation will have to play a critical role. And Sheba's ARC program will need to be completely brought to its full force to really make an important contribution in fighting this virus. And so that's what happened. We actually declared what we called the battle mode, the ARC battle mode for COVID-19, with the idea that right now ARC is completely focusing on battling COVID-19, on finding solutions to better understand the virus. And to do that, we've pretty much halted all of our activities that were not COVID related at the beginning of March to fully focus on that. As we took our first steps into trying to come up with solutions, we knew our major problems were numerous, from trying to find a vaccine, to trying to find a new medication, to coming up with diagnostic solutions to allow us to more quickly identify the virus and people that contracted the virus, to coming up with solutions for ventilation. As you know, that was a major issue that we were faced with, especially in the first days of COVID. We've seen examples from China, from north of Italy, and even from New York about hospitals that ran out of ventilators and had to have new ventilation solutions if we were to be able to provide treatment for every patient who contracted the virus and became mortally ill. We needed to come up with solutions for monitoring, come up with mobile solutions, come up with solutions around big data and artificial intelligence. And this was the full focus of what ARC has set out to do, coming up with solutions around all of these areas, which were our new focus starting the very initial days in March of this year. A lot have happened since then. As you know, probably in Israel, we went through a first wave. We had a quiet period for about a month and a half. We're into a second wave right now. You know, I might be able to tell you more about that if you have questions later on. But what we've done later, and this happened late in May, is decided to capture it all in what we call the Health Space 2030. What is Health Space 2030? You've seen the name on the invitation to this webinar. Health Space 2030 was the name we gave to a virtual environment, a simulated space in Sheba that allows us to test the technologies of the future in one location for multiple purposes, whether it's to demonstrate, whether it's to train our staff to work with new technology and new solutions. This was planned towards the end of this year when we sat down to plan for 2020. We didn't know, of course, we were expecting this pandemic to come along. And what happened during the months of April was a decision we've made, which you have to agree was a fairly bold decision, not to wait with Health Space 2030 to post-COVID, like many of our plans were put on hold, but to push forward and to implement this smart patient room here at Sheba, specifically directed towards COVID-19, to show our achievements and the amount of innovation that happened at Sheba during these months. And the innovation was really incredible. Just to give you some numbers, we came up with more than 45 different invention declarations of different inventions. We filed for 17 patents during a span of about 2.5 months, 17 patents. And about half of these patents we took to commercialization. Either a company spun out or we provided the license to the patent to another company to actually market and sell the product for about 8 of our different inventions. This is incredible in a span of 2.5 months. These are numbers that we typically see in a year or even more than a year. But in 2.5 months, because of the amount of innovation we were pushing for during times of crisis, and utilizing what ARC stands for, the acceleration to redesign healthcare by collaborating with partners and partnering up with all the different partners we had here in Israel and abroad. And I'll be happy to talk more about that if there'll be any questions later on. We were able to achieve much of these achievements you're going to see in a few seconds. So we've put it all together in this virtual space, and then to demonstrate it, we came up with this video that you're going to see now. And what we're going to do now is run through the video, which is a simulation of a patient contracting the disease and then going through the different stages of the disease as we follow the patient and understand what kind of technology is at hand that came out of Sheba. I'll stop here and there a few times to share that with you and show you to pause on some of the technologies and provide some more information. So this is our patient, Mr. Eyal Cohen, 40 years old, tested positive. And you see him here in a hospital room at Sheba. This is, of course, a simulated room. But what we see in the simulated room is also a control room where the staff is behind the glass,
everything will be okay.
Looking inside into what's going on with the patient.
I'll talk to you in a minute.
Let's see what's going on.
Okay, bye.
Hello, Mr. Cohen. My name is Dr. Goodman, and I'm about to ask you a few questions regarding your medical condition. We will use some new technologies that can assist us to evaluate your condition. So, how do you feel today?
Feel okay?
Are you sure? You know, the Vocalis app installed on your cell phone detects changes in your voice and breathing. It might indicate a deterioration in your condition. Have you noticed any changes during the night?
Nothing out of the ordinary.
Do you have a cough?
No.
Do you still feel any shortness of breath?
Now that you mention it, it might be a bit worse than yesterday.
Can you describe what has changed?
I don't know. I feel like I can't get enough air.
I'm sorry to hear that. So in order to help you, I will need to examine you. And as you know, we will be using the checks remotely, and I will need your help. If something is...
So just a couple of pointers before we continue. First of all, this is an actor, so not to worry. It's not a real patient, and everything is just played along. What we've heard already is we've seen use of two technologies. One is this robot you see. This is an Israeli robot developed with Sheba Medical Center called Meditemi. And the robot allows the staff to come and approach the patient and talk with the patient. And the idea was we are trying to minimize the contact between our staff and the patients so that we prevent staff from contracting the virus. As you know, this was an issue in China, in Italy, in some other locations where many of the staff members became sick. Some of the staff members even died because of this disease. And that is a major problem. And of course, we wanted to try and avoid it as much as possible. So when possible, we use this robot, Meditemi, that you're seeing here. The other technology we've heard about is the Vocalis app. Now, the Vocalis app is an app on your phone that is being developed now at Sheba that allows the patient to talk into the app on his phone. And through the app, we're able to diagnose the severity of the symptoms and also whether there is a virus or not. This is now going through tests and studies. We're getting great results on diagnosing the severity of symptoms, and we're working on diagnosing the virus. We're still quite away from that point, but even just being able to diagnose the symptoms is, of course, of great help. So let's continue to see what's going on.
If you have any questions, please let me know. And please now open the TytoCare kit next to you, and we will start with you holding the main device.
So what we see here is another technology, an Israeli technology working with Sheba called TytoCare.
Great, exactly that one.
We're using this technology to allow the doctor, who's in another room, I remind you, in this case in the control room, to examine the patient without being in the same room with him. And you'll see in a second, apart from measuring temperature as we're seeing right now, this technology is also able to listen to the heart of the patient, listen to the lung sounds of the patient, look into the throat, and look into the ear of the patient. And so the doctor, again, in another room, is able to do almost a complete physical examination on our patient without being in the same room with him and in danger of contracting the virus. Let's see how that's being done.
This?
Yes, exactly. You will be seeing it on the screen as well in a second. Connected. Great. Okay. So now you can see your chest, and we will be checking for lung sounds remotely. So please place the stethoscope on your chest as shown. Good. Great. You can now move it to the next spot as shown. Okay. Now move it to the next spot. And to the next spot. Okay, thank you, Mr. Cohen, for helping me. All of the information from your exams will be recorded directly to your medical file. And for the meantime, please try to rest as much as possible. And if you need anything, please let us know.
A couple of days later, as you see, same department, we're looking at the technology called Early Sense. This is the monitor. Early Sense is an Israeli technology that allows us to monitor the patients continuously. The sensor is under the mattress, not touching the patient at all, but allowing us to measure continuously very important vital signs like heart rate and respiration rate. And through an artificial intelligence solution, the device is able to warn us when the patient is about to deteriorate. What you can see here on the screen is heart rate and ventilation rate across time going up, and the artificial intelligence alerting us that something is wrong with the patient. Now
Okay.
the doctor is coming into the room because we
So
need
hello, Mr. Cohen.
the
It's
physical
me,
contact.
Dr. Goodman. We spoke before through the screen. I've come in to speak to you. So I would like to tell you that through the early sense system that is connected to you, we can see that you are having more difficulties in breathing. Yes. And we really would like to see if we can go on treating you here, but we would like to consider the ability to transfer you to the intensive care unit if needed. So first of all, what I want to give you is a little bit more oxygen than you're receiving now through the mask. It's a mask with a bag, do you see, like this? Just breathe normally through it. Okay? Great. Now, I know you might have concerns and questions, and please ask anything that you have to ask. But first of all, I would like to ask you, would you like to speak to your family?
Yeah, I understand. Can I speak to my wife?
Certainly, and we'll do our best to organize it through our screen so that you have better visual and that you can speak to her.
As
Okay.
you might know, one of
I'll
the
keep you
problems
informed.
that we have with COVID patients is contact with their family members. So we try to avoid contact between, of course, healthy family members and the patient, again, with the danger of them contracting the virus. And again, we can use technology to allow the family members to speak with their loved ones. This is critical because in many ways, or many places around the world where the technology does not exist, believe it or not, there is very, very little communication between patient and family up to the last minutes of the life in some of the patients that even died in the hospital. We've heard a lot about these instances, and technology can come and help us to increase and allow communication.
Hey Joe,
Hey, how are you?
you don't look good.
I'm okay. My situation's getting a little bit worse. So they're transferring me to intensive care unit.
You have trouble breathing.
Yes, so I'll talk to you as soon as I can.
You can talk to me in the ICU like we're talking now.
I don't know, but I'll let you know as soon as I can.
I love you.
We've had a lot of responses from family members that said that this type of technology really helped them in keeping communication with their loved ones inside the hospital. So this was very critical on day to day.
Transfer Mr. Cohen in bed number 1 to the intensive care unit. Can you help me find an available bed for him?
Okay, let me see in the clue system if there is an available bed over there. Okay, I can see that bed number 4 is available, and I'm going to coordinate the transfer.
Okay, great. Thank you so much.
What we've seen was the Clue medical system, which is an artificial intelligence system again, that allows us to manage all of our intensive care unit patients. In one system, we get all the data and all the insights and the alerts about patients in the ICU, so we can know which patient is ready to be discharged and which patient is in danger of continuously deteriorating and so on. What you're seeing now is another technology that was developed here at Sheba together with a company called AnyVision. It allows us to perform investigations into contacts that happen in the hospital if we want to identify contacts for isolation. So for example, if we have a staff member who was found positive for the virus, we need to trace back and see who are the other staff members that were in contact with this person so that they need to go into isolation as well. And we're using an artificial intelligence again to diagnose contacts between people. You can see here in this demonstration, we know that this doctor specifically was found positive. and we can see who was in contact with. The computer would actually tell us who needs to go into isolation. This is, of course, something that we're now putting available to all hospitals in the world, and it's a technology that can really help in diagnosing the contacts and probable people that contract the virus. So now we're moving into the intensive care unit. Our patient has
Alice, can you tell me the urine output in the last hour?
Yeah, according to the Sereno system, it's 105 milliliters. It's been like that for the past 8 hours. Dr. Ellen?
Yeah.
We just got a notification by the CLUE system that Mr. Cohen in bed number 3 is expected to be in a severe respiratory deterioration in the next 8 hours.
Oh, let me see his vital signs.
Again, this is the CLUE,
I understand
CLUE
that.
system
Okay, I think
that I've mentioned before. It allows us to see which patients are about to deteriorate. 8 hours upfront alert.
Mr. Cohen, how are you feeling? Not that good. We can see that you're having respiratory problems. What we would like to do now is sedate you and ventilate you. I think it's going to help you much more. Now, when we sedate you, you're going to be asleep. So would you like me to call your wife before, so you can speak to her a little bit before?
Yes, please call my wife as
No problem.
soon as possible.
No problem. We will do that.
Hello, honey, can you hear me?
Yes, how you doing?
We're fine, but what about you? What's going on? Tell me everything.
I don't want to get you worried, but
This is another
Well, not,
communication
100%
system
of
called a
them.
company called Uniper that was actually built to be used at home, mostly for elderly people at home who need to be able to communicate with family members, with friends, with communities. It can be attached to any television, and turning the television into a communication station that allows people, elderly people at home who are many times alone, to have a full community through the TV.
Send my regards to your mom, your dad, and we're gonna meet very soon, I promise.
I love you so much.
Love you. Take care. I'll pray for you.
Yeah, you pray for me.
Bye, honey. Bye-bye.
Bye-bye.
Anesthesiologist to bed 4, please.
So what do you say about that? What does it mean?
It means that its status, its conditions deteriorate during that
Patient in
time.
bed 4 is in respiratory distress.
Wait a second. Nurse Naomi, please get to bed number 4.
Now what we're seeing is the nurse in the ICU. She has a problem with the ventilator. Instead of calling a technician
Hi, Dr. Miller. This is
to
Naomi, the
come
nurse
in,
in the COVID
she puts
ICU.
on
I have a
augmented
low pressure
reality
alarm of the
glasses.
ventilator that I can't resolve
This is the
myself, and I
Microsoft
need your
HoloLens 2,
assistance,
one of the
please.
most advanced augmented reality glasses in the world. And the technician actually helps her through the augmented reality to solve the problem. Let's see how it works.
Okay, the patient circuit looks fine. Show me, please, the ventilator screen. Okay, let me show you which button you should press.
Okay.
It's this one. Can you see?
No.
Okay. You should press this button.
Okay.
Lower the peak from 10 to 3.
This is called teleguidance.
Thank you. The alarm is resolved.
You're welcome.
So this was our patient as he went through the intensive care unit, and then we'll see what happens later. Of course, I'll let you know it has a good ending, so not to worry. Yeah. This is one of our staff members. She's after a long shift. She has some free time. One of the things we are also trying to do is to provide some relaxation to the staff members, because we know with the COVID-19, we're seeing a lot of strain on our clinical teams and burnout. And one of the things that was shown to help is this type of relaxation, using, again, augmented and virtual reality. So our patient actually, his condition has improved and is now in the respiratory rehabilitation department. Now he does not have the virus, and so his wife is next to him holding his hand. And of course, this is a much more, a better way to communicate than through screens.
I love you, and I'll be here. I'll be here forever, I promise.
So this was the journey we've taken together. I now hear there might be a Netflix series that starts about the COVID-19 patients at Sheba, and of course that's just humor. But from our perspective, this was one way in about 15 to 20 minutes to showcase much of the innovation that just came out from Sheba in a matter of about 2.5 months. This was really unparalleled. And we've shared some of this with many of our friends and collaborators around the world. We've had a webinar at the end of May with more than 1,000 people from around the world that joined and have seen this use of this technology. And we're helping many hospitals around the world to use this technology and better treat their patients. It's part of the ARC mission and Sheba's mission to be a guiding light and show the path forward for many of the other hospitals around the world, and we're putting a big effort on that. So I think I'll stop here, and of course we'll leave time for questions. I'll be happy to take those.
Thank you, Eyal. People should understand in LA that Eyal has been averaging at least 1 to 2 webinars a day. I don't know how much rest he's actually gotten during these last few months. Usually he spends his time on planes when he's been grounded. So since he's been grounded, he's been able to do webinars and devote a tremendous amount of time to helping to develop these revolutionary technologies. And so because he's been literally on the front lines, we're going to go and ask him some of the questions that have been submitted for today. So first of all, I think it's important that everybody wants to know, we know what the situation is in California, we know what the situation is across America, and unfortunately now we have been dragged into what we call a second wave. I don't know if it's a second wave or a continuation of the first wave. Can you explain to our guests today where Israel is going and what it's doing in order to deal with this second wave going forward?
Sure. So for those of you, I'm sure many of you are following the news coming out of Israel, but just to sort of recap, we had our first wave. We've seen maybe a total of about 18,000 patients in the span of 2.5 to 3 months, with about 300 people dead. Of course, every person dead is a tragedy, but the overall numbers looked very, very small and low compared to the entire world. We were very much talked about as an example of how this type of pandemic needs to be handled. After a long lockdown, we started reopening, and apparently we know this now, the reopening was too fast, and people thought that this was behind us. We were too optimistic, and sure enough, the virus is still around and has brought up its head again, and we're in this, what we call now the second wave, with more than now 30,000 people in Israel that were tested positive. So numbers are continuing to grow. However, this is critical to mention, and I will say why I think this is so. We're still seeing a very low rate of mortality, a very low rate of patients on a ventilator. Right now, in the entire country of Israel, we have about less than 50 people on a ventilator in the entire country. Here at Sheba, we have 5. So really low numbers, obviously, as you compare them to the US or any other country, although the prevalence, the number of people on in the community now that have the virus is always on the rise. And whether we're going to need to go through a second lockdown is still an open question. The reason I think we're seeing a low mortality rate, which is really one of the lowest in the world, is I think two reasons. One, we've done a pretty good job in protecting the elderly population. We're seeing that the average age of people that have contracted the virus is very low compared to other countries. And as long as it remains low, we're going to see low numbers of people hospitalized and, of course, serious cases and, of course, mortality. And this has been one success here in Israel that without it, we would have been in a very different situation. The second is what we're seeing in the second time around, as we're encountering this virus now for the second time around, we're seeing that we're much better able to treat patients. We have a better sense of what works and what doesn't. We know what kind of drugs to provide to patients. We know that we're trying to delay ventilation as much as possible rather than go to ventilation very early on, as we've done in the first wave. Much of that are the things we've learned here at Sheba and globally. And of course, we're working with the international community to gather every insight possible. We've also done a lot of work around big data and using applications such as artificial intelligence to alert us to what kind of therapy each patient needs. All of these solutions, I think, helps us get better results for our patients, and that is why we're seeing a high number of patients that are very mild or even intermediate, but very low number of severe patients and, of course, ventilated patients. So from that perspective, although numbers are rising every day, and although we might go into another lockdown, I think we are doing a good job in controlling the severe cases and, of course, having a very low mortality rate. Hopefully, that doesn't change.
Eyal, there's always been speculation about the people who have contracted the virus. According to our statistics today at Sheba, 60% of those who have corona are men, 40% are women. Has that been the standard from the first wave, or has it changed, and is there a reason for that?
We have seen this in the first wave as well. I think we've seen this type of statistics in other places in the world. We know that men very slightly contract the virus more than women, maybe 2 or 3% difference. But the severe cases, if you are a man, it's a type of risk factor for this virus. So if you contract the virus, men are probably a bit more likely to develop a severe disease than women are. And so when we look at only patients who are hospitalized, and of course, when we look at only patients who have severe disease, we're seeing something like 25% women, 75% men, very clear cut towards more men having severe disease. We don't have a good explanation for that. So we don't really know why are men contracting a more severe disease, developing a more severe disease. We know in medicine there are differences. It could be related to hormones. It could be related to other factors. We know that, for example, some autoimmune disease are much more common in females than in males. So these type of differences probably play a role here as well. With time, as we understand more the disease and the virus, I think we'll have a better answer to this question.
Okay. And of course, people in LA are monitoring the news here in Israel with great interest, and they've been reading about the politics and the strain on our system with nurses and doctors between the Ministry of Health. Can you tell our people who are mamash, what you would call dedicated to our cause, as to where we stand in dealing with this problem going forward, and maybe how they can help us along the way?
That's a great question and a real problem that we have here in Israel. In Israel, our main problem are not resources currently in terms of the government stepping in. Our main problems are with staffing. This is where we're in a problem. To open a new corona unit or a new Corona ICU, we don't have more people we can bring in from the streets. You have to train people, you have to train nurses, you have to train doctors, of course, ICU nurses and ICU doctors even more than that. So it's not possible for us to just bring in new staff. So what we need to do is allocate our staff from the normal wards, from the normal departments to the Corona departments, so that we're able to open up these new units to treat patients coming in and grow our capacity to treat the COVID-19 patients. This is something that is a problem. Our way to try and deal with this problem, of course, again, it's a fact that we cannot bring in more staff. The main way for us and method that we've utilized is try to bring in new technology, like the technology you have seen, developing new solutions that will allow us with the current staff to provide better treatments. This is the Israeli innovation. This is the Sheba innovation. This is what ARC is all about, coming up with solutions that will allow us to treat patients better, not just by adding another nurse or another doctor, but by providing the existing nurses and doctors with better solutions that will allow them to treat better the growing number of patients that we're seeing. Artificial intelligence, communication tools, monitoring tools, all of that you've seen here, this is our way to push this forward, and we're leading the world in terms of this type of development. And this is where we think we need to put the effort. This is where we all need to mobilize to be able to provide more and more solutions and provide those solutions, not just to Sheba, but to take them out to the entire world.
Yeah, just to underscore what Eyal is saying, that the interest in Sheba's ability to deal with this pandemic through technology. The other day, we did a webinar with China, right, Eyal? And how many people were on that webinar? 10,000 people were on that webinar. So you can understand where the interest is in Sheba, and Sheba being what we would call the National Hospital of Israel, look to us to find those solutions rather than having manpower, using technology to replace that manpower in order to accomplish what we need to do. The next question that was imposed to us, and I think it's a very relevant question, is that one of the advantages of Sheba being in a top 10 hospital for 2 years in a row is that a lot of hospitals in the United States have recognized Sheba's growing global impact. How is Sheba sharing its info with other hospitals in the United States and vice versa? Because we know that we're getting calls almost every single day. Can you give some examples of that?
Sure. So, on day-to-day, before COVID, we're working very closely with many leading hospitals in the world. We have our own hospital community we work very closely with. They're part of ARC, our ecosystem. And these are leading hospitals, mostly from North America. You're familiar with many of the names. In your neighborhood, it's even Cedars-Sinai that we work very closely with, but many other hospitals around the US, Canada, and Europe. And we're sharing much of what we're learning with this growing community. And it's not just the ARC community, but as Steve was giving an example from China, another example, Steve, this was about 3 months ago, we almost forgot, but we were on a webinar hosted by the American Hospital Association and the Federation of American Hospitals, with about 500 hospitals on the line, listening to what Sheba had to say on innovation, on telemedicine, and other fronts. So more than 500 hospitals in the US tuned in to listen to the innovation coming out of Sheba. So we're making a huge effort. Steve was mentioning that I do a webinar or two every day, which is true. We're doing a true effort to share what we're learning and to work with others to come up with new solutions. And I'll share another secret. We don't typically say this. We even worked a couple of times with the New York Department of Health when New York was the major crisis. We all remember this about a month and a half ago. They reached out to us because they had a couple of problems they had no solutions to. So the New York Department of Health reached out to Sheba, and we gathered a few partners on our side here in Israel to come up with solutions and send them over to New York during their times of need. So it's a very tight collaboration, and I think people are looking to Sheba for guidance during these times of crisis.
Molly, I'll turn the microphone over to you for a question or two from your end.
Thank you, Steve. And thank you, Dr. Zimlichman and Yoel and all of our friends at Sheba for making today possible. I also want to give a very quick shout out to those of you who missed the very first minute of today. It wouldn't be possible without Vikki Fine Pharmacy, today's presenting sponsor. So we appreciate you. We have a question here in the chat about any additional preventative measures that people should be taking for COVID.
I'm guessing, and I'm going to answer, you mean on each of us on a personal level in terms of protective measures. This really has not really changed across time. I was in the US, you remember, Steve, very late in February when this thing was just coming around the horizon. It was still far away. We heard news from China during the time. And I was on national TV. And I was asked that question, and I gave pretty much the same answer I'm giving today. It's about wearing a mask, it's about hand hygiene, and it's about social distancing. These are the three things that we still need to comply with. And I will mention that what we've learned with time is that mask is critical. If we all comply with putting on a mask the proper way, covering the mouth and the nose, and if everybody complies with that, it's amazing, but we can almost return to normal activities if we were all to comply with that. We know now that the regular mask, what we call the surgical mask, is very effective in preventing the disease from spreading and protecting each of us. Doesn't mean that the other two factors that I mentioned are less important, but I think the recent months have really re-emphasized the importance of having a mask. And again, if we wear a mask, we're almost able to go back to routines. The problem is that sometimes, we take it off. Sometimes we put our nose out. Sometimes we drink, obviously, and eat in a public location. And so I don't think that a mask was invented that you can eat through. Maybe that's an invention for ARC to think about. But that is one of the problems we have.
A zipper. There is one.
Maybe a zipper on the mask. But this is the main solution. So I urge everyone to keep their masks on, especially in closed spaces. This is the one thing that we all need to comply with.
Ina Tullar has a very good question because we deal with this on a day-to-day basis. The long-term side effects for patients and COVID-19. I think Eyal, explain how Sheba is actually doing that with a unique clinic that we have, because there are unfortunately a lot of side effects.
Right. This is another thing we're learning, because remember, just a few months ago, we didn't have the long effect perspective. We couldn't really understand what are the long effect complications. So we're starting to understand now, especially if you contract a life-threatening disease, if you're hospitalized and specifically if you're in the ICU, many of these patients develop very prolonged side effects, which could really affect almost any organ in the body, from the skin to the kidneys to of course, the lungs, to the brain, to the heart. Almost every system can be affected, and we're seeing a very wide and diverse complication range from COVID. I'll also mention that even if you have a mild to moderate disease, we're learning from a lot of patients who said, listen, we were very active before, we were running marathons before, and now, I just had a relatively mild disease, but I can't seem to go back to what I was doing before, to the amount of effort I was doing before. And it takes a long while to get back to your normal self after this disease. So on one end, most people just have a very mild form of disease, many ways flu-like, as we like to call it, with no complications. But if you do have a moderate, and obviously if you do have a severe disease, there is a possibility of long-term effects, which we think now could go on for some patients for years, whether it's the need for rehabilitation later on. And here we're doing a lot of work on that at Sheba with our rehabilitation hospital. And many of our patients who were a long time in the ICU have moved on to the rehabilitation hospital. And the rehabilitation hospital, which we thought at the beginning of this was not going to play a critical role, is now playing a very critical role in providing our patients with the solutions needed.
And of course, there's been a lot of speculation in the media about once you have the coronavirus, is it possible for you? Have we seen any cases here where you could possibly get it again, or what are the chances of building up enough of antibodies in your body to create some sort of immune response to another round of the COVID virus?
Another question, which I might call the big bonanza, because this is a question that is very critical, obviously, as you could all understand. I'll say one thing. We do understand that probably immunity is not for life. We're seeing some cases where the antibody count is dropping with time, and we're starting to see cases where the antibodies are basically almost gone a couple of months later. This is very individual between patients. What we have not seen is a confirmed, and I'll say this very clearly, we have not seen confirmed cases of patients who contracted the disease twice. Although there have been reports about this in the news, these were likely cases where there was a mistake with the test. As you know, the tests many times, when it's negative, it has a pretty high false negative rate, which means that you might test negative on the test, on the PCR, when you're actually positive. That's why when you're negative, we many times ask you to retake the test to see 2 negative tests to be sure that you're actually negative. So maybe somebody has the disease, was tested negative, thought he was over the disease, and then was tested again and found positive. We think it's probably because of a mistake on the PCR testing. So we've not seen these type of cases. But the reason this question, Steve, is so critical is because this will shed a lot of light later on the effectiveness of the vaccine. What we're likely to be seeing, and of course we don't know for sure, is that vaccination, when they do come around, will provide us with immunity for a certain amount of time. Whether it's 6 months, whether it's 1 year, whether it's 5 years, we don't know. And of course, it will depend on the vaccination. There are many companies working on a vaccine, as you know, and different types of vaccines will have different span of immunization. But likely we will need to repeat vaccination after a while, like we're doing with influenza, like we're doing with other types of infectious disease, viral disease we're seeing. So one vaccine will not provide you with immunity for life. We will need to retest and revaccinate patients once we do have a vaccine out.
Thank you, Eyal. I'd like to turn the microphone over to Yoel as we wrap things up here, 5 minutes out. Yoel?
Yeah, hello, everyone in LA and over the US continent. I want to thank Eyal Zimlichman for sharing his knowledge and his experience in the last, I will say, 3.5 months here. Thank you, Steve, for elaborating this mission. I want to thank the professional staff in LA, Rachel and Molly, and of course, Ina and Vikki for co-chairing this wonderful opportunity. Personally, you know that I will prefer to put on my talks and be with you at the Four Seasons, but due to the situation, I need to sit here with Eyal and Steve and just dream and hope to see you next year with good health. So wishing you a beautiful day and stay safe. Shalom and goodbye.
Thank you.